Everyone really. If you have any desire to improve the health and quality of your skin, be it for age-related changes, scarring, or an actual condition such as eczema, you want to keep watching. Remember, aging is still damage. It's just more covert and gradual than a wound, but it is still damage. Regenerative medicine applies to everyone. First, we need to understand what happens naturally in our body. We have around 200 types of cells, but the most special are the stem cells. So these can transform into one or more of these 200 cell types, effectively replacing damaged cells, and this is a continual process of renewal. Regenerative medicine is a science of repairing or replacing diseased or damaged cells, tissues or organs. Now, this can be accomplished in two ways. First, stem cells, which I just mentioned, can directly replace the diseased cells by transforming into the required cell type. For the boffins, this is by engrafting and differentiation. So this is what happens during a bone marrow transplant, where the donor stem cells replace the patient's blood and immune stem cells. The second method of regenerative medicine is the paracrine effect. In this mechanism, some of the specialised donor cells act to stimulate the patient's cells to repair the diseased tissue without the donor cells contributing directly to the new tissue. This happens because the donor cells secrete factors that signal the patient's cells to change their behaviour, and this cell-to-cell signalling is called the paracrine effect. Now, in many early studies of stem cell transplants, researchers observed that the damaged patient tissue was repaired after the transplant, but when the new tissue was analysed, there was a noticeable absence of donor cells. So subsequently, scientists were able to demonstrate that the donor stem cells were secreting factors that triggered the patient's cells to repair the tissue themselves. The continual process of cell renewal I mentioned at the start is not a perfect process, and thus we can present with diseases or signs of damage. Consider the wound repair mechanism in mammals. As amazing as it is only capable of repairing small wounds. It's unable to repair large wounds or to regenerate new functioning tissue instead of just scar tissue. Thus, we used to believe that our cells were incapable of true regeneration. However, studies of mammalian tissue have shown that our cells are capable of regeneration via the paracrine effect. They just need the right signals, and that is where exosomes come in. Exosomes are the mediators of cell-to-cell communication. They're the key behind the paracrine effect. Think of them as signalling pods sent by the stem cells to do their magic. These tiny ambassadors have important messages for target cells. So they travel between cells, example skin fibroblasts, which make collagen and elastin, keratinocytes, immune cells, and transfer numerous growth factors and inflammatory cytokines and genetic materials responsible for tissue repair and immune modulation. These powerful messengers act as avatars of the stem cells. Exosomes are not cells. Critically, they are inherently less risky than live stem cell transplants. Exosomes cannot replicate, they cannot transform into cancerous cells or other harmful cell types, and they're less likely to trigger an immunogenic response in the recipient. They can also not be infected with a virus. Many different cell types can invoke a paracrine response. These include cells from the bone marrow, adipose tissue, i.e. fat, and umbilical cord that connects a mother with her fetus. We use exosomes derived from the stem cells of adipose tissue. The therapeutic exosome preparation we use can easily be taken up by human skin cells, which means that they can easily message skin cells to do something. These stem cell derived exosomes contain over 500 types of miRNA or microscopic RNA. This is not genetic code like mRNA or DNA that many people will have heard of. Microscopic RNA pairs up with a segment of mRNA in the host cell, thereby stopping it producing the protein it is meant to. So miRNA is effectively down-regulating or silencing certain activity. So the exosomes we use have over 90 different mRNAs specifically for skin rejuvenation. Example, there are 8 for brightening, 7 for anti-aging, and 46 that are anti-itching. There are also 200 different proteins, all for skin rejuvenation. Example, 44 for wound healing and 4 to help with elastosis, i.e. skin laxity. There are also over 50 growth factors, and all my patients have certainly heard about growth factors from me in the past. I've used these topically for many years in scarring and anti-aging protocols. Our new GF5 bioregenerative serum by Galderma is based on 5 different growth factors, and that alone is amazing. So imagine what these exosomes are capable of. We perform injections with a fine microneedle into the skin. It's a comfortable procedure and you can carry on with your daily routine immediately afterwards. We may use this topically with certain treatments. Exosomes are best used in combination with other treatments, and we have tailored our pre-existing protocols to incorporate this wonderful technology. Studies have indicated that paracrine effect is amplified because these exosomes are attracted to the damaged tissues that need their help. The damaged patient cells are secreting cytokines, regulatory proteins that act as mediators to generate an immune response that attract the exosomes. These exosomes can then enter donor cells and exert their regulatory function to reduce inflammation, promote cell proliferation, and increase vascularization and blood flow into the areas that need to heal. This is difficult to quantify because it depends on what you are trying to treat and what your outcome measures are. However, let us revisit the topic of stem cell therapy. At first, most scientists were disappointed that transplanted donor cells often did not contribute directly to new tissue. But the advantages of having a paracrine effect soon became apparent. The most important observation was that even though the donor cells were short-lived, they had a long-term effect on the tissue regeneration. It seems that they are important for initiating tissue repair, but are dispensable once the patient's cells are activated. The fact that donor cells do not have to persist in order to achieve a cure via the paracrine effect has the implication that unmatched donor cells can be used. The unmatched cells will survive for 1 to 2 weeks in a patient before they are rejected, and this is enough time for the cells to initiate tissue regeneration. Of course, in the case of exosome therapy, we do not need to worry about matching donor and patient because cells are not being used. However, the underlying message is the same. Our cells just need that initial trigger from the exosomes, and they will behave accordingly. There is a dose-dependent effect in that, depending on what the clinical goal is, one needs multiple doses of the signalling messengers to achieve the desired outcome. If I'm treating a 30-year-old with healthy skin who simply wishes to maintain his healthy look, one session may be sufficient. If, however, his 60-year-old mother comes in wanting some reversal of aging signs, a course will be warranted, most likely in combination with at least one other modality. One has to customise the treatment programme to the patient, and of course it is not based on age alone. There are lots of other good treatments out there. There's one technique in which one takes a small piece of skin tissue with the underlying fat from a donor site on the person, for example, from this area, and then uses an in-clinic device to process this into an injectable product that can then be injected somewhere else, for example, somewhere where there's hair thinning. However, this is quite invasive. Other options exist for using pre-prepared conditioned media containing stem cells. The issue with using donor stem cells is that there is a risk, albeit small, of inducing an immune response in the host, and there is a variety of other cell and protein matter that is simply not needed. By utilising high-tech filtration methods and electron microscopy, these exosomes have been isolated and the end product is free of all other unnecessary matter. This means we have a highly safe and ultra-pure product with more power in its punch. You can visit regenerate-myskin.co.uk or check out our Exosomes webpage at perfectskinsolutions.co.uk.